Hi you guys, what's up? Welcome back to my YouTube channel. I am Dr. Conan Beg and I am pursuing content full time for a year now. I love to be in front of the camera. I love to do editing. I love to be behind the camera. I love to do everything that is involved with filmmaking and videos and editing and photos, and it just floats my boat. It makes me very happy, and to be able to do it full time right now, I'm super happy and super privileged that I get to buy this opportunity for myself. So thank you very much for always supporting me through your likes, comments, shares and subscriptions and follows and everything. It just makes my heart so full and so happy. Today in this video we are going to discuss everything about skincare, everything that I know and I do about skincare, at least as of now. If you are here from a recent reel that just went viral, where I am talking about stress acne, so that is a very real concern for me. As a doctor, I know a lot of things that we preach, we are unable to practice that ourselves. For example, when we tell our patients to eat right, to work out, to stress less, to get some mental health therapy, some kind of mental health assistance, there are days when we're not able to do that for ourselves as well. We don't sleep enough, we don't eat right. I mean, I have survived my med school on ramen and coffee, so of course I am bound to have like a lot of stress acne. And right now, since a year that I am doing content full time, and now I'm living on my own. It's almost 3-4 months that I'm living on my own, paying all my bills, doing everything. My skin has literally cleared up. There are acne marks here and there, as you can see, but overall the makeup looks great because the base is great. You know, when the face itself as a base is not great, if the canvas is not good, the painting kitna bhi, you know, how many ever layers you put on top of it, it won't pop, it won't look good. You need to think right, feel right, be right within yourself. And you know, when nobody is looking at you, wo time pe aap kya kar rahe ho? Are you sleeping enough? Are you getting your workout? Are you doing your 10k steps? Are you thinking good things about yourself? And you know, celebrating other people, celebrating yourself, and doing the little things here and there which make you a better person. When you start doing those things for yourself, you genuinely become better from inside, and it literally shows on your skin. I was struggling. I was struggling throughout med school. I have been a great kid at academics throughout my life. Like मैं बचपन से ऐसे फर्स्ट आने वाली बच्ची थी, highly competitive, always want to be on the top of things, and I want to do this, I want to do that, very all-rounder. The light is changing so much, it's looking so pretty. Yes, light also plays a big role in how you appear on the camera, so please be aware that everything on the camera is not real. Light की वजह से काफ़ी changes आते हैं. So yeah, what was I saying? I've always been that kid who has been academically great and academically inclined, and you know, 10th में मतलब 90%, 12th में I dropped my percent, I got 75% because I was just so dead with all the work. I couldn't. I have worked my ass off all these years studying and doing things, and don't get me wrong, I love the sciences, I love to study, but the system in which we are gave me so much stress and so much pressure that my skin literally kept breaking out. I had to literally work out every single day, or at least like 4 times a week, so that I can maintain myself physically. Yet I feel like I'm not in my best shape. I'm not in my best shape, neither physically nor mentally, and a lot needs to be done when it comes to health and wellness. It's a very holistic experience, and coming from someone who has studied or trained in evidence-based medicine, you really need to understand that we as doctors are humans as well, and practicing what you preach is very hard, and it's very it's necessary for everyone to do it themselves. And therefore, you know, leaving medicine feels like the best decision of my life. It just makes me so happy every day to wake up when I want to work as much as I want to sleep when I want to work out whenever I want to. I don't have to answer anybody, and this just lifts off a lot of pressure. Yes, I understand that a lot of people have a lot of responsibilities and they are not prepared to do something like this, and I don't suggest anybody else to do something like this as well at a whim or, you know, impulsively. But then if you aim at doing something like this, start preparing today. I always felt like med school was not enough for me. I started preparing towards the content journey as a child. Like, I used to consume so much Bollywood movies and so many Bollywood songs. I was like a big Bollywood buff. I always wanted to like be in front of the camera, do makeup, do this, do that. I come from a very humble middle class family, and all of this was very new and very weird and very nobody encouraged in my family to do this. So basically, like, I was good at two things. I was good at academics, and I was also good at creative pursuits. By the end of my third year, around fourth year, when COVID struck the world, I decided to just do something with the excess time that I had, the time that I was saving from all the commute and, you know, not meeting people and being isolated. I just started doing some photography, some portrait photography. But with final year studies and everything, that didn't really took off. So I had to find a way where I can, study and create content at the same time, while neither of them are hampered. I can separate them and manage them, because it's really hard to manage med school as it is, and when you add like another thing on top of it, it really gets crazy. I am not even kidding, it gets super crazy. But then when you try to balance out a little bit, थोड़ा थोड़ा करके हो जाता है, कभी कभार नहीं हो पाता है, बट ठीक है, जितना हो रहा है उतना करो, बाकी leave it. Talking about skincare, this video was supposed to be entirely about skincare. I just started off with my entire history and geography. Am I sorry? I hope it helped you. I'm not sorry. So yeah, so basically I'm talking about something like I always follow CTSMS. CTSMS is cleanse, tone, serum, moisturize and sunscreen. तो cleansing में double cleansing का एक concept है. And double cleansing is something that you need to do if you've had like a full face of makeup, or if you've had like a full day where you've applied sunscreen twice or thrice in a day. So at the end of the day, you need like a double cleansing. Early in the morning, I feel like a single cleanse is fine, or once before the bed, single cleansing is fine, because you don't want to rip off the natural oils that are secreted by your skin, the natural lipids that your skin has secreted for moisturization. You don't want to rip it off. So you go for cleansing in the morning and in the night, double cleansing if you have a lot of makeup on your face, or if you have like too much sunscreen on your face. That's when you do it. Toning, I go for a very nice mild moisturizing toner by the Face Shop. It really helps calm my skin. It makes me very happy. And for moisturizer, I use something like Requil moisturizer, the thick moisturizer. It really helps me hydrate my skin. But I'll tell you the trick with moisturization. If you have put a serum, moisturize के पहले serum आएगा. Tone, serum, moisturize. So serum में I got this PR, Dr. Sue's Exosome serum, and whenever you apply a new serum, your face is going to break out. Like for example, do you see this? Yesterday or day before yesterday, I started trying vitamin C serum and niacinamide serum. Niacinamide I got from Ordinary, vitamin C was from Foxtail. And applying new actives on your skin always, more often than not, causes some sort of breakout, some sort of reaction. So what that means is your face is reacting to something new. Since they are very strong concentrations, you need to reduce the number of times you're applying. You need to calm the inflammation with icing or whatever, and you need to just let your skin be for some time, and then again you can reintroduce the actives. So for serum, I'm using Dr. Sue's Exosome peptide serum. Initially, even that caused a little bit of breakout on my face, but with time it has really helped me with my skin. Overall, it has really helped with my skin. So that's for serum. And for moisturizer, I was saying that if you're in a very humid climate, you need like a very light gel moisturizer. Those times I go for something like a Pond's Super Light Gel Moisturizer. But if you are in a very air conditioned environment, it's cold and you need it's not very humid, you need a thick moisturizer. So if the moisturizer is thick, it is going to allow the serum to sit beneath the moisturizer on the top of your skin and be absorbed into your skin while not suffocating it. So that's how it works. You don't have to suffocate the serum, you need to add to it, you need to aid to it. On top of that, you need sunscreen. Now sunscreen, as the name implies, it is something that you apply when there is sun, right? Let me break this down. Sunscreen is for when there is light, even by which I mean in my PM routine I apply sunscreen. So basically, if you can see things, there is light. You cannot see anything without light. अगर आप रूम का लाइट बंद कर दो तो आपको कुछ दिखाई नहीं देगा ना. Simple. Like that, if you can see anything, there is light. If there is light, you need exposure protection or light protection. That is what is sunscreen. So you need to apply sunscreen 2 to 3 times a day, included in your PM routine as well. And yeah, that should really be helpful. Fourth most important is your pillowcase is extremely important when it comes to face acne. So you need to have like silk pillowcases. You need to change them twice a week. Silk or cotton, both would do. You need to change it twice a week. There's a lot of bacteria on the pillow. So when you sleep on it, you need to understand that you need to tape your mouth if at all that works for you. But if not, change your pillowcases as often as you can. Even if you're taping, you need to change it because there's a lot of oil and sweat that your skin releases and it is absorbed by the pillow, and sleeping on the same pillow without changing it for more than 3 days is absolutely like a way to invite more acne on your face. So coming back to all the history that I was providing in the first 5 minutes, how is that helpful? Agar you are stressed and your lifestyle is really bad, you're not sleeping enough, you're having like a lot of caffeine throughout the day, you're super stressed, you have like a lot of cortisol spikes and you're junk eating, you have glucose spikes, all of this will cause your skin to break out, for you to have like poor bowel movement, you'll have faster aging, a lot of things, hair thinning, fatigue, loss of energy, loss of libido. A lot of things can be caused because of poor lifestyle. You need to start with eating right, sleeping right, sleep at least 7 to 8 hours every day. Eat protein and fiber equivalent to the amount of carbs that you're eating, by which I mean if you're eating like a bowl of rice, take a bowl of protein, maybe through chicken, paneer, whatever, veg, non-veg is your preference. And don't forget to include fiber in your diet because fiber really helps with, absorption and digestion. It's like the basics. And always try to eat your fiber first, try to eat your veggies first, because when they go into your intestine, they form a sort of mesh which reduces the sugar spiking. And even if like 2 people are eating similar amount of calories throughout the day, but one has more sugar spikes than the other person who doesn't have as much sugar spikes will live a better life, will have a better quality of life. So the mesh that is created by fiber in the intestine reduces the amount of carbohydrate absorption. I have been told that I'm great with explaining science by a lot of my friends, but when it comes to speaking to camera and explaining like this, I just feel like sometimes I'm too repetitive. Yeah, I really love to talk science. I really love to study sciences, the health sciences and everything. I'm a big buff. I absolutely love to do that. Then at times it's just overwhelming, even if you're doing this for a long time. So yeah. So I have been speaking for a very long time. I hope this was helpful. I hope I could break some myths for you and some things for you. Let me know if this is something that you really enjoy. I will do more of these videos. And yeah, don't forget to subscribe. Lots of love. See you in the next one. Bye.